Madam Speaker, I hereby announce the passage by the Senate of the following House file, herewith returned as amended by the Senate, in which amendments to concurrence of the House is respectfully requested. House File Number 2725, an act relating to the judiciary. Message is signed Cal R. Ludeman, Secretary of the Senate. Edelson moves that the House concur in the Senate amendments to House File Number 2725 and that the bill be repassed as amended by the Senate.
The member from Hennepin, Representative Edelson.
Thank you, Madam Chair and members. This is a concurrence, and I ask that you accept it. The Senate added on an amendment that puts mental health provisions in here, things like loan forgiveness for mental health providers. Really good mental health initiatives that will help our community and our states. I ask that you vote green.
Any discussion on the motion to concur with the Senate amendments? Seeing none, all those in favor, please say aye. Aye. Those opposed, please say no. The motion prevails. The clerk will give the bill its third reading as amended by the Senate.
Third reading, House File Number 2725, as amended by the Senate.
Third reading as amended by the Senate. Discussion. The member from Isanti, Representative Dowd.
Thank you, Madam Speaker. I want to tell everybody I appreciate your efforts on this, but not in the last 24 hours. This issue is too big to be rushing a bill that people haven't talked about more than the last 24 or 48 hours. I literally learned about this bill this afternoon by reading a tweet about an agreement. And this issue is a real issue. And this bill, unfortunately, doesn't solve those problems. So we have a problem in that we don't have enough mental health beds. And while this bill lifts the cap for that, it doesn't provide the money that will actually fund the hospitals. My hospital in my community had mental health beds in their hospital, and they actually stopped offering those mental health beds because there wasn't enough reimbursement to cover that. So there are probably a lot of good things in this bill, but if I were to criticize all of us, I would say that we lacked the courage to actually do the big reforms that this state needs and that this issue needs. So I'm going to ask people to vote against this bill tonight, and this is something where we actually probably need a subcommittee on this particular issue next year. This is an issue that's too big and has been around too long to not give it the serious attention that it needs. And again, this stuff was peeled out of another bill. It's coming to the floor at 11:54 at night on the last night of session. And the people who are impacted by mental health issues and the family members who love them deserve more attention and a better effort than this. And unfortunately, there's a lot of areas where this bill falls short. I'm not going to eat up time talking about that tonight, but I'd encourage people, unfortunately, to vote against this.
Any further discussion? Seeing none, the clerk will take the roll on the bill. Will the clerk please call the names of the members who've not yet voted?
Ackland. Ackland. Anderson.
Anderson, no.
Anderson, no. Bowe.
Bowe votes aye.
Bowe, aye. Damath. Damath, no. Frankie. Frankie. Frazier. Frazier. Garofalo.
Garofalo, no.
Garofalo, no. Gruenhagen.
Gruenhagen, no.
Gruenhagen, no. Hanson J.
Hanson J. I.
Hanson J. I. Hausman. Hausman. Hertas. Hertas, no. Hewitt. Hewitt. Hewitt, aye. Lippert.
Lippert, aye.
Lippert, aye. Mariani. Mariani. McDonald. McDonald, no. Nelson, N. Nelson, N. Pearson.
Pearson, no.
Pearson, no. Schumacher.
Schumacher, no.
Schumacher, no. Tice. Tice. Thompson. Thompson.
Thompson, aye.
Thompson, aye. Ackland. Ackland. Frankie. Frankie. Frazier. Frazier. Thank you. Frazier, aye. Hausman. Hausman. Mariani. Mariani. Nelson, N.
The clerk,
Nelson, N.
Bo.
Bo changes from aye to no.
Bo changes from aye to nay.
The clerk will close the roll. There being 68 ayes and 60 nays, the bill is repassed as amended by the Senate and its title agreed to.